Okay, so today I'm going to be pointing out some anatomical landmarks on a panoramic radiograph, and I'm going to start with image number 1, and this image was assigned. So we're going to start right off with the condyle, and the condyle is really easy for me to remember because it forms a swooping motion downwards, and this S we have created stands for the sigmoid notch. Sigmoid notch is here, and it comes up a little bit to the coronoid process. And if we go reference our human skull, we can see the condyle, the sigmoid notch, the coronoid process. And this is all part of the mandible. Next, we're going to go a little mesial, and we're going to see a connecting line kind of from the coronoid process, this radiopaque line, and it's proximal to the maxillary molars, and this structure that we see is the floor of the maxillary sinus. And if we go a little mesial to the face, we're going to see this radiopaque vertical line, which is the anterior nasal septum, and above we have the anterior nasal spine, and then we have this septum here. We also have, on this image compared to the rest of the images, we have a really nice view of the cervical vertebrae, and these were going to appear as radiopaque, almost plate-like. You can't miss them. You'll know what it is when you see them. In outlining the cervical vertebrae, we're going to have the posterior pharyngeal wall. And while I was talking about the maxillary sinuses, we see a structure right above that kind of goes through the condyle and the sigmoid notch and the coronoid process, and this is the zygomatic arch, which is really important, and many more structures come off of that piece. So if we go down here, we can put all our pieces together of the mandible. Also on this image, I really like that we can see the external oblique ridge on the mandible. And that is going to be more of a bony projection here, and you can mostly see it right behind the molars. Next, I want to talk about a radiopaque structure on the mandible as well. It is going to be right below the central incisors, right here. Oftentimes it looks like a bullseye, like this. And this is called the genial tubercles. And that's about it for image number 1. Now I'm going to come down here to image number 2. And I know right off the bat you're thinking, wow, this is a terrible image. And that's exactly why I picked it. So I picked this image because I was easily able to identify the errors. So first we see that this image is obviously not symmetrical. We can see there's some distortion throughout the teeth. They look a bit wide in some areas. Also looking at this image, we can see the patient's right ramus is much wider than the patient's left. So that tells us there's some distortion, and this is all a product from patient positioning. There's also some blurring throughout the structure in the nasal structures as well. It's not clear compared to an image such as the one above. So to solve the patient positioning error, we would definitely want to make sure some things are accurate. First, on our panoramic radio machine, here's my little person, we would want to make sure the mid-sagittal plane is right between the eyes and the eyebrows. You don't really want to line it up with the patient's nose because their nose could be crooked. So we want it right down the middle of their face, and that's known as the mid-sagittal plane. We would also want to line up another plane called the Frankfurt plane, and we want that pointing right at the tragus of the ear. But despite all these errors, we can still identify some landmarks here. So first, I want to talk about this floating structure on the bottom region of the radiograph, and this almost radiopaque thicker structure is the hyoid bone. And this is easy to know because this is, when I first learned it, I was like, what the heck? There's a bone down there? And this is the hyoid bone. So that does appear on a radiographic image, so it's important to know what that is. Next, in order to identify some other parts of this radiograph, I'm going to point out the inferior border of the mandible. And as we work our way to the posterior section, we have the posterior border of the mandible. And the posterior border of the mandible is known as the ramus. And that's going to be the upright section. Next, we have the angle of the mandible. And this is really important. Like I was saying, we need to know more structures to identify more of a radiograph. The angle of the mandible is like a protrusion. As we look at this image, we can see it here really well in here. And the angle of the mandible is what's going to give us this ghost image, which is almost parallel to the hyoid bone and is going to go across, and it's just the angle. Next, as we're talking about horizontal structures, I'm going to point out the hard palate of the maxilla. It is going to be a radiopaque line, and this line comes out very radiopaque compared to the rest of the image. Like if we look on that first image, there's the hard palate. On this image, we can easily see the orbit. We can also see the inferior orbital rim. It's pretty blurry in this image, but we have the nasal cavity. I mentioned the hard palate in our ghost image. Right below our hard palate, between the central incisors, we're going to have our incisive foramen. This is in the maxilla, and it appears as an oval radiolucency between the roots of the maxillary central incisors. Next, I'm going to be talking about image number 3. So first, I really like this image because we can see this structure, which has two radiopaque outlines, and it comes out to this radiolucent structure. This is known as the mandibular canal or the inferior alveolar canal, and it appears as a radiolucent tube-like structure, like I said, with two radiopaque parallel lines, and it starts at the mandibular foramen and works itself to the lingual side of the ramus, continuing to the buccal surface of the body of the mandible, and ends at the mental foramen. The mental foramen can usually be found adjacent to the second mandibular premolars, so it will be usually in this region here, and it's going to be a radiolucent circle. Next, following the body of the mandible, just parallel here to the ramus, we see a long structure like so, and it's almost like a pen shape. And I remember this structure as it is like a stylus pen. And it's going to be radiopaque, almost crooked diagonal structure. Superior to the canal, we can see the articular fossa in the coronoid process here. And we have the zygomatic arch, which kind of passes through them, which makes it easier to see the articular, the eminence bone, the protrusion of the bone. And now we can talk about the maxillary tuberosity, and it's going to be the most distal region of the maxilla, and it's going to be right here, maxillary tuberosity. And as we were talking about articulate eminence, here by the condyle, we also have the glenoid fossa. But here you go, and here is my anatomical landmarks.